Adcetris is an anti-cancer drug, and as with other potentially toxic compounds, caution should be exercised when handling Adcetris. Proper aseptic technique should be followed throughout the handling of this medicinal product. Recommended safety measures for handling and preparation include masks, protective clothing, gloves, and biological safety cabinets, such as laminar flow hoods. Adcetris, brentuximab vedotin, is an antibody-drug conjugate composed of a CD30-directed monoclonal antibody that is covalently linked to the antimicrotubule agent monomethyl auristatin E, MMAE. Adcetris is indicated for the treatment of adult patients with relapsed or refractory CD30-positive Hodgkin lymphoma, HL, following autologous stem cell transplant or following at least 2 prior therapies when autologous stem cell transplantation or multi-agent chemotherapy is not a treatment option. Adcetris is also indicated for the treatment of adult patients with relapsed or refractory systemic anaplastic large cell lymphoma. Adcetris treatment should be administered under the supervision of a physician experienced in the use of anti-cancer agents. The product is supplied in a carton that contains a glass vial with a butyl rubber stopper and an aluminium and plastic flip-off seal containing 50 mg powder. The product is a white to off-white cake or powder. It consists of the active ingredient brentuximab vedotin. Each vial of Adcetris contains 50 mg of brentuximab vedotin. There are materials that are required for reconstitution and infusion that are not provided in the carton. These include a bag containing sodium chloride 9 mg per milliliter, 0.9% solution, or 5% dextrose or lactated Ringer's solution for injection. Sterile syringes with Luer lock. Sterile water for injection, USP bag or vials. And sterile injection needles. The cartons of Adcetris are shipped in a temperature-controlled box between 2 and 8 degrees Celsius. Upon receipt of the product, immediately open, inspect, and inventory the shipment. It should be confirmed that each carton contains a vial. Confirm the product is in date with adequate shelf life remaining by checking the expiry date. Following completion of the receipt process, transfer and store the material in a refrigerator between 2 and 8 degrees Celsius. It is important not to freeze Adcetris. Keep the vial in the outer carton in order to protect it from light. Proper aseptic technique should be followed throughout the handling of this medicinal product. Each Adcetris carton manufactured by Takeda contains 1 vial of 50 mg of brentuximab vedotin. Unpack the sodium chloride 9 mg per milliliter, 0.9% solution bag, or 5% dextrose or lactated Ringer's solution for injection, a needle, and the syringe. First, the flip-off caps are removed from the Adcetris vials. To reconstitute each 50 mg vial of Adcetris, 10.5 milliliters of sterile water is required. Using the syringe, the water is then added to the vial, directing the stream toward the wall of the vial and not directly at the cake or powder. Then gently swirl the vial to aid dissolution. Do not shake the vial. The reconstituted solution in the vial should be a clear to slightly opalescent, colorless solution. The solution should be visually inspected for any particulate matter or discoloration. If any discoloration or particulate matter is observed, the reconstituted solution must be discarded. After reconstitution, each milliliter of solution contains 5 mg of brentuximab vedotin. The chemical and physical in-use stability of reconstituted Adcetris in solution has been demonstrated for 24 hours at 2 to 8 degrees Celsius. From a microbiological point of view, the product should be used immediately. The recommended dose of Adcetris is 1.8 mg per kilogram as an intravenous infusion over 30 minutes every 3 weeks. The appropriate dose of reconstituted Adcetris to be administered and the number of vials required to prepare the infusion solution is calculated as shown on screen. Please note that if the patient's weight is more than 100 kilograms, the dose calculation should use 100 kilograms. The maximum recommended dose is 180 milligrams. Once the appropriate amount of reconstituted Adcetris required for infusion has been withdrawn from the vial or vials, it is then added to an infusion bag containing sodium chloride 9 mg per milliliter, 0.9% solution, or 5% dextrose or lactated ringers, in order to achieve a final concentration of 0.4 to 1.2 mg per milliliter of Adcetris. A diluent volume of 150 milliliters is recommended. As Adcetris contains no bacteriostatic preservatives, any unused portion left in the vial must be discarded. The bag is then gently inverted to mix the solution. Care must be taken not to shake the bag. Finally, patient identification, along with the time and date, should be added to the label on the bag, now containing the reconstituted and diluted solution. Do not add other medicinal products to the prepared Adcetris infusion solution or intravenous infusion set. Following dilution, infuse the Adcetris solution immediately at the recommended infusion rate. When the reconstituted solution is diluted immediately, the chemical and physical in-use stability of the diluted solution has been demonstrated for 24 hours at 2 to 8 degrees Celsius. If not used immediately, in-use storage time and conditions prior to use are the responsibility of the user. Please note that a vial of Adcetris is for single use only. Please discard any unused product and the materials used in the reconstitution process in accordance with your hospital's disposal procedures for anti-cancer products. The product is now ready for use with the patient. The recommended dose is 1.8 mg per kilogram administered as an intravenous infusion over 30 minutes every 3 weeks. Administration is carried out by a nurse or physician who will also monitor the patient during and after infusion. Adcetris is infused intravenously over the course of 30 minutes and must not be administered as an intravenous push or bolus injection. The infusion line should be flushed following administration with sodium chloride 9 mg per milliliter, 0.9% solution for injection, 5% dextrose for injection, or lactated ringers for injection. The patient's complete blood count should be monitored prior to administration of each dose of Adcetris to check for hematological toxicities and/or febrile neutropenia. Patients who achieve stable disease or better should receive a minimum of 8 cycles and up to a maximum of 16 cycles until disease progression or unacceptable toxicity occurs. Procedures for proper handling and disposal of anti-cancer medicines should be carried out. Detailed information on this product is provided in the packaged leaflet within each carton and the summary product of characteristics. Adverse events should be reported according to each country's adverse event reporting requirements. If you have any other questions on the use of this product or would like to obtain the prescribing information for Adcetris, please contact your local Takeda Medical Information representative.